Hello and welcome to the Health and Government Operations Committee hearings. We have a number of bills to hear today, and we have a very tight time frame because we have to be back on the House floor at 2:30. So we are going to go efficiently today. Many of these are identical cross files. We do have some departmental bills and a few bills we haven't had cross-filed. We are going to start with Senate Bill 207 because that is joint with the Economic Matters Committee, and we have several members of the Economic Matters Committee here with us today. Welcome. That Senate Bill 207 is a departmental bill, insurance carriers and managed care organizations, cybersecurity standards. And I understand we have Van Dorsey here who's going to tell us about this bill.
Yes, hi. Good afternoon. Van Dorsey, I'm principal counsel for the Maryland Insurance Administration. Senate Bill 207 establishes data security and incident response requirements for segments of the insurance industry. It is based on the National Association of Insurance Commissioners model. It is a bill that has been fully vetted in the Senate, and we have worked out a number of amendments that you see as part of this with both industry and the Office of the Attorney General. I'm going to try to be brief because I know you have a lot to go over. So unless there are any further questions, I'll just ask for a favorable report.
Thank you for that excellent testimony. Do we have questions from the committee or the ECM members who are joining us on this bill? I'll give you a second to raise your hands. Okay, and it sounds like everybody's on board with this bill and everything was worked out over in the Senate already.
That is correct.
That is great to hear. Thank you so much. Seeing no hands up, that concludes the hearing on Senate Bill 207. Now we're going to move through what we can of the Senate cross files. I understand that Senator Kelly is here. So our first bill for that is Senate Bill 677, Maryland Healthcare Commission Nursing Homes Reporting. Now, this was not an identical cross file, so there is a panel on this bill. Chairman Kelly, welcome. And then we will hear from Stevan Ellis as well as Claudia Baylog.
Yes, good afternoon. This is
you are not the chairman, but it's yes, welcome. Happy to see you. Go ahead.
Linda Forsythe, Senator, still on the floor. So I'm testifying today on Senate Bill 666. And Senate Bill 666 is here with significant amendments.
Are we talking about 666 or 677?
I mean 677. I'm sorry. And the bill had there were concerns of healthcare slippage and poor financial management for far too many Maryland nursing homes serving our most fragile and medically needed elderly patients. Let's review together significant declines in quality of care combined in far too many cases with poor financial management concerning members of private equity investment companies purchasing Maryland nursing homes based on a profit motive with little or no concern for the health needs of the elderly folks that they were to be taken care of. COVID-19 has highlighted and exacerbated short staffing, a problem that has long existed in the nursing home industry. I have been working with advocates, industry representatives, regulators, and other legislators to identify and address concerns at our nursing homes, including the rapid transfer of ownership in this industry and the increasing number of nursing home purchases by private equity investment companies more interested in company profits than in promoting healthy and socially affirming environments for their nursing home residents. In December of 2020, the Washington Post reported the terrible conditions at a major chain of skilled nursing facilities purchased by a private equity investment company. Family members and concerned staff described unsafe condition for the residents, coupled with reduced wages and benefits for staff immediately following the purchase. I am proud of the work that colleagues accomplished last session to pass a bill that requires increased quality surveys of Maryland nursing homes sold to out-of-state operators. SB 704, which was last year's survey bill, has given us an important tool And
I'm not sure.
I'm sorry. And the Maryland Office of Healthcare Quality reports that we expect about 6 of our Maryland nursing homes to transfer to an out-of-state operator this year. Maryland needs a much clearer picture of the quality, the service deficits, and the financial management and affordability of our nursing homes. And we need a better understanding of how many are at risk of being purchased by bad actors. Nursing homes already file cost reports, and our Healthcare Commission uses this information for healthcare planning. We do need to understand more regarding industry trends. Are nonprofit facilities faring worse than for-profits? Are there concerning trends that regulators can identify across ownership chains? Are good established operations at the risk of being acquired by private equity companies, which are more concerned about profits than the delivery of quality service? Information regarding the finances and quality controls of nursing homes are not easily accessible to nursing home residents or to their families and advisors. Although our nursing homes are supported by Medicaid dollars, as amended, SB 677 will not require a new calendar of audits, but will reflect advice from the Maryland Healthcare Commission Senate. As amended, it highlights each change of ownership of any Maryland nursing home during the calendar year. It describes the management trends of Maryland nursing homes by ownership group and by region, and reports a summary of financial data included in public use data sets so that the public and the legislature can see profitability, operating costs, and expenses, as well as margins. Senate Bill 677 and HB 747 started out as exact cross files, but SB 677 was amended in the Senate to address concerns by the Maryland Healthcare Commission. I would therefore request that HGO Committee and the House pass not only 677, but also HB 74 in the same posture.
Thank you very much for your testimony. And I do want to clarify, as you just mentioned, this is actually a cross file of HB 747. So we're not going to have, it's going to be a sponsor only. So if members have questions, now is the time, and we have written testimony from the other witnesses. Do we have any questions from members of the committee on this bill? I don't see any hands up. Delegate Hill, go ahead.
Yeah, just real quick, just so I hear, we're going to put them in the same posture, but I wasn't clear. We want the House bill in the Senate posture. We want the Senate amendments taken off and put in the House posture. I just need clarification.
So originally they started out in the same posture, 747 as well as 677. And then there was a concern expressed by Ben Steffen from Maryland Healthcare Commission. And so he amended the Senate bill. And that's what was passed by Senate Finance, and that's what was passed by the Senate, the amended version that was sanctioned by the Maryland Healthcare Commission.
So the Senate's going to amend the House to match. You don't want
Delegate Hill, the House bill has not passed. So that's the issue at hand here. Great. Thank you so much. So seeing no more questions, that concludes the hearing on Senate Bill 677. Thank you so much for being with us today.
Thank you.
We are going to hear next from, I believe there's a representative from Senator Augustine's office here on Senate Bill 591, Maryland Healthcare Commission, Patient Safety Center Designation and Fund. We have someone from
Kelly.
Oh, Senator Augustine himself. Welcome.
Yep, I am here.
Just so you know, we are going speedy because the House is back on the floor at 2:30.
Yep,
great.
absolutely.
Thank you.
Senate Bill 591 is in the same posture as House Bill 915 that passed third reader in the Senate this morning. I ask for a favorable report on Senate Bill 591.
Excellent. Well done. Great testimony. Any questions on Senate Bill 591? I do not see any hands up, so that will conclude the hearing on that bill. And we will move to Senate Bill 518, Career Pathways for Healthcare Workers Program. Senator Augustine.
Thank you, Chair Kelly. Senate Bill 518 does have a cross file, but it has not yet moved. We've worked out between the stakeholders language that they are all comfortable with to create this Career Pathways for Healthcare Worker Program located in the Maryland Department of Labor. The purpose of the program is to provide matching grants to hospitals and nursing homes the pay for identified training programs that are consistent with labor markets needs, and specifies that grant funds are training that was completed by the healthcare worker. Training programs are intended to be provided for healthcare workers by historical Black college, university, or community college. Requires that wage increase information be given to interested healthcare workers, and specifies that a wage increase be consistent with market trends, and provides that grant funds pass through to a specified fund based on certain bargaining agreements. Matching grants are limited to $50,000, and there is also a $1 million mandated appropriation for the program. Happy to answer any questions, but I do ask for a favorable report on Senate Bill 518.
Excellent. Thank you, Senator Augustine. Do we have any questions for the senator on this bill? While we wait for hands, I will let you know that the subcommittee does have this bill, and we are waiting to hear back from appropriations on that. So thank you.
Thank you for your advocacy, Chair Kelly. I'm grateful.
Absolutely. I see no questions. So that will conclude the hearing on Senate Bill 518. Thank you so much. Next up, we may or may not have Senator Beidle here. Do we have Senator Beidle? If not, I can present Continuing Care at Home Certificates of Need Exemption, which was a Senator Beidle bill, and a Kelly cross-file, which passed the committee unanimously. It was a great bill. Oh, Senator Beidle's here. Go ahead. And do you have anything to add?
Thank you, Delegate Kelly, and I just got back. I know you were going to present 804, so you know it well. I will tell you that today on the floor, I amended the House bill to match the effective date of the Senate bill, which is July at the request of the department instead of October. So we made it an earlier effective date because they really want to get this continuing care certificate of need started. So it's the same form as you passed it out of the House. It's just simply changing the effective date.
Excellent, wonderful, and we will definitely make sure to match that because I know we need to do that. Do we have any questions for Senator Beidle on this bill? Looks like none, so that will conclude the hearing on Senate Bill 804. I don't think we have anything else from Senator Beidle today, so thank you for joining us. We appreciate you. Always great to see you.
Thank you.
Next, we have actually, is Senator McCray here? If not, I do see Senator Hester, so we can go to her bills. Senator McCray?
They're not here.
Okay, let us.
Sorry.
No, it's okay.
Natasha Mehu is going to be presenting for them, and she's here.
Okay, let's go ahead and do that then. Senate Bill 568, Health Records and Reporting on Overdoses, Limitations on Use in Criminal Investigations or Prosecution. And we will hear from Natasha Mehu. And you're getting the idea. We're trying to be efficient because we got to be on the floor. Nice to see you.
Thank you. Natasha May here on behalf of the Baltimore City Administration in support of Senate Bill 568 with amendments. This is a cross-file of House Bill 786, which was heard by this committee just a few weeks ago. It seeks to close a loophole in the overdose, the legislative intent of the law that required medical service providers to report overdose information to the overdose mapping applications. This data was not to be used for criminal investigations or prosecutions. However, there was a bit of a loophole here. This committee did request a letter from the Attorney General, which did confirm that this bill was necessary to close that loophole. And our amendments are the same amendments we presented for the House bill, which would essentially specify that they are not allowed to obtain this information from an overdose patient's medical records. And so we hope that you can align the two bills and then pass it favorably. Thank you.
Thank you so much. We have a question from Delegate Shalega.
Good afternoon. How are you, Natasha?
Good. How are you?
I'm good. So when we spoke about this bill last time, I think we had discussed potentially having you all talk to the police chief Harrison about this issue because it is a HIPAA violation. So it's against the law now. So were you able to do that, to just have him instruct his officers that they're not permitted to do this? We can't hear you. Oh, sorry.
The police department is in support of this bill as well. It is much broader than just Baltimore City. It is also for the prosecutors, all people involved in criminal investigations, and the Attorney General office said that this was necessary to help make it clear that no one violates this provision in terms of using that data, that they're not to use the data for criminal investigations or prosecution.
Yeah, I think perhaps did the Attorney General opine on whether it's a HIPAA violation?
Posed to them. The question was posed in the bill in its current form, whether it was necessary to ensure that the law enforcement and other investigators could not then bypass the existing legislation, which was to prohibit using the information from the mapping application by then trying to get that same information from the emergency services providers. And that is what the Attorney General's letter focused on, and said that this bill would help provide that clarification and ensure that it is clear that they're not allowed to use this information.
All right, perhaps, Madam Chair, I'll ask for a AG opinion on it, whether it's a HIPAA violation already. Thank you.
Thank you so much. Do we have any more questions? Seeing none, that's going to conclude the hearing on Senate Bill 568. Thank you so much. We're going to move to Senator Kramer's bills. He has two. I believe he is here, or representative. Senate Bill 824, Health Accessibility of Electronic Advanced Care Planning Documents. Who is here? Senator Kramer?
I am here, Madam Chair, and thank you. And pardon me, members of the committee, Ben Kramer introducing Senate Bill 824. And Madam Chair, you tell me how far you want me to go. And
we are going speedy. So if you have an identical cross-file with Delegate Cullison, let us know.
And that it is, Madam Chair, and that's what I wanted to know, because I figured you all know this bill. My thanks to the very talented Delegate Cullison for all of her work and effort and time that went into the bill that's before the committee this year. And with that, thank you, Madam Chair.
Absolutely. Do we have any questions for Senator Kramer on 824? I do not see any hands up, so we will move right into another excellent identical cross-file, which is Senate Bill 823. Senator Kramer.
Yes, and again, Madam Chair, thank you. Ben Kramer introducing Senate Bill 823, which is sort of a technical cleanup to our PSAO legislation and a very talented cross-file in the House. I thank you for that, Madam Chair. And with that, certainly would welcome any questions, but I do thank the committee for your time.
Excellent. Thank you so much. Do we have any questions? Seeing none, that will conclude the hearing on Senate Bill 822.
And Madam Chair,
yes.
May I just quickly, point of personal preference, just to say, I am so sorry that we are losing the committee chair. She has been a huge asset to the Maryland General Assembly. I know I'm not going to see you again after this, Madam Chair. So I want to thank you for your public service, for all your hard work, effort, and all that you have brought to the Maryland General Assembly and the people of the great state of Maryland. And with that, I thank you all. Have a great day.
Thank you.
A message well worth our time today, Senator Kramer. Thank you. Did you want to say something, Chairman Pendergrass?
Only thank you. I'll miss everybody here, including you.
You'll be missed.
Thank you.
Thank you, Senator Kramer. Next up, we have Senator Benson, who I believe is here. Senate Bill 661, Pharmacist Status as Healthcare Providers and Study on Reimbursement. Do we have Senator Benson or a representative here?
Yes, I'm the representative for Senator Benson.
Go right ahead.
Good
I
afternoon.
believe that is an identical cross-file with Delegate Bandari, correct?
Senate Bill 661, yes.
Perfect. So all we need to know is that it is identical, and then you will be perfect.
Yes, it is identical. Thank you.
Excellent. Do we have any questions for the representative? I don't see any hands up, so that concludes the hearing on Senate Bill 661. Thank you very much. Senator Lamb, Senate Bill 548. Do we have someone here? I do see Senator Lamb's staff is here. So Senate Bill 548, Local Health Officers Removal Process. Who's here from Senator Lamb's office?
Hi, good afternoon. This is Chris Daniel from Senator Lamb's office. Thank you, Chair, and thank you, members of the committee. For the record, my name is Chris Daniel. I'm the Legislative Director for Senator Lamb, here to present SB 548. I'm not sure if you consider this an identical cross file, but it's one in which the House sponsor, who you'd like to thank Delegate Pena-Melnick for concurring with the version that was amended in the Senate. Just briefly, since the amendments weren't before you beforehand, this bill addressed some concerns that we had with the inability, or concerns that are raised about the inability to remove a local health officer for reasons other than cause. I think the language wasn't as tight for some of the stakeholders. And so to that extent, it's been amended to address those concerns, and it's also been amended to remove the OEH provisions and to clarify that the appeal pathway post-secretary is more appropriately administered with the circuit court. So with that, I'm happy to take any questions, and thank you again for the opportunity to present.
Excellent. We have a question from Delegate Saab. Go ahead.
Thank you, Madam Chairman. Can you expand a little bit on the amendments? So what is exactly the difference now, or what does the amendment do?
Yeah, certainly. And forgive me for my brief remarks. I was not expecting to have to present today, but the amendments generally, they took out the reasons for cause that were in the original bill. There was concerns raised by MACO amongst others that
So
perhaps—
Chris, can I stop? Are the amendments that you have on the Senate bill the same as the amendments we put on the House bill?
I believe they should be. Yes, I believe. Yeah.
I think that will help. Yeah.
But also they were edited further post. If you're discussing the amendments that were on the House bill when it was first voted out of the House, they do differ a little bit more. If you look at the third reader here, basically we took out the reasons for cause, which addressed MACO's concerns amongst others who perhaps wanted to do, a shift of change in an office environment that wasn't related to cause. We also took out OAH on the direction of Senator Casserly, who thought that the circuit court was probably the best and most appropriate pathway following that. And let me see if I can pull up the bill. Was there any other questions, Delegate Saab, or can I be of more clarification? Can I provide more clarification for you, or?
No, I'm going to go back and actually read the reprint and
Okay.
have questions in our voting session. Thank you.
We do have a question from Delegate Krebs.
Yeah, I mean, I think some of these, I think we maybe should take this back to subcommittee to understand some of these changes, because changing the circuit court, changing the cause, I'm not sure what they're going to apply to the circuit court if there's no rules to apply around. So it's a little complicated. I just would hope we'd spend a little time figuring out what we're in and not what there. It's a really serious bill. It'll be the only person in state and county government that is not at will. And we need to make sure it's a very important position. So I think we should take the time to make sure we get it right. And I know we don't have time right now, but I would suggest taking it back to subcommittee for that conversation.
Madam Chair,
Yes.
we will spend the appropriate amount of time on this bill. This is an important bill. I agree with Delegate Cullis and Delegate Krebs, excuse me. And this is not an at-will position of the counties. This is a state employee. Let us not forget, this is a state employee. Thank you.
Okay, with that, do we have any more questions on this bill? I do not see any more hands up. So we will conclude the hearing on Senate Bill 548. Thank you so much, Chris. I believe there is someone, either Senator Klausmeier or someone from her office here to talk about Senate Bill 700, Maryland Department of Health, Prevent Workplace Violence in Healthcare Settings Public Awareness Campaign Work Group. Senator Klausmeier.
Hi, yes, this is Sam Deschanel, Senator Klausmeier's Chief of Staff on her behalf. I will keep this quick for you guys. Senate Bill 700 is in the same posture as House Bill 1389, which passed unanimously both the committee and on the House floor, and I can answer any questions you guys have.
Excellent. Do we have any questions? I do not see any hands up, so I think we are good, and we can conclude the hearing on Senate Bill 700, but move on to Senate Bill 574, which is Organ and Tissue Donation Awareness Fund, Annual Funding and Extension. Go right ahead.
Again, Sam Deschanel on behalf of Senator Klausmeier. Senate Bill 574 doesn't technically have a designated cross-file, but it is identical to House Bill 1370, which was approved unanimously by the committee, and I can answer any questions that you have on the bill.
We have a question from Delegate Rosenberg. Go right ahead.
Can you send our regards to your father, Warren?
Of course I will.
Thank you.
Thanks, Delegate.
Excellent. Any more questions? I see none, so that will conclude the hearing on Senate Bill 574. Thank you so much. Senate Bill 707, health insurance provider panels coverage for non-participation. Go right ahead.
Again, Sam Deschanel for Senator Klausmeyer. Senate Bill 707, as amended, is identical to House Bill 912, which was unanimously approved in committee and on the House floor, and I believe just passed the Senate floor today. So I can answer any questions you have on that bill as well.
Excellent. Thank you. Do we have any questions? I do not see any hands up on this bill, so that's a great sign. We will conclude the hearing on House Bill 707. Thank you so much. Next up is Senator Hester. Thank you for your patience. Senate Bill 632, Maryland Health Benefit Exchange, Small Business and Nonprofit Health Insurance Subsidies Program Work Group. Senator Hester.
Thank you so much, Chair. And I'd also like to start by thanking Chair Pendergrass for her amazing service, not only to this committee, but also to the Howard County delegation, while she will be incredibly missed. Members of the committee, thank you for your consideration of Senate Bill 632, which now requires the Maryland Health Benefit Exchange to convene a work group on the expansion of small business health insurance subsidies to close the coverage gap for small businesses, nonprofits, and their employees. This bill is identical in spirit to HB 709, which you heard from committee colleague Delegate Lewis on February 17th, to create subsidies for small businesses to offer health insurance to their employees. However, during the committee process in the Senate, there were several complications, and the amendments basically amend the bill down to a technical work group to discover how best to implement the program. For these reasons, I respectfully request a favorable report on Senate Bill 632, and I look forward to coming back next year to implement the recommendations of the study.
Thank you. We have a question from Delegate Cullison.
Thank you very much, Madam Chair. I was wondering if there would be any concerns about delaying the time that the report is due. I understand right now the bill says it's October, and there's a interest, I understand, in delaying that a little bit more time to give the exchange a little more time to write the report. So if we went to December, would there be any problem with that?
So I'd be happy to follow up offline, but in earlier conversations between committee staff and the exchange, they thought it would be doable in that time frame. And part of the reason for having it done in October is because in the bill itself, there's intent language about introducing legislation to look forward the next year. So I really think that this is a sliver of people without health insurance that have been missed. And so that was the reason we asked for October, but I'd be happy to talk with you offline. Thank you.
Thank you. Thank you, Senator.
Excellent. Any more questions? I don't see any more questions, so we can conclude the hearing on Senate Bill 632. We have a couple of sunset extensions and one more MIA bill, and it is 202. So we're going to keep going and see how far we can go. Let's do Senate Bill 195, State Board of Examiners of Psychologists sunset extension, and I believe we have Lorraine Smith here to present that. Is Ms. Smith here?
She is. She just has to unmute.
Lorraine Smith, are you able to unmute and present the bill for Senate Bill 195? If not, we'll move on to the next bill until you get yourself ready. All right, let's give her a few moments and we will move on and see if, do we have Mashika Bunyan from the Board of Optometry here?
Yes, Chair, I am here.
Excellent.
Good afternoon.
Let's do your bill. So we will do Senate Bill 202, which is the State Board of Examiners in Optometry sunset extension. Go ahead and present your bill.
Good afternoon, Chair and members of the committee. I am Dr. Mashika Bunyan, representing as the president of the Maryland Board of Examiners in Optometry. So the testimony that I have for Sunset Bill 202 is favorable for the amendment. The Board of Examiners in Optometry has no outstanding deficiencies to correct as indicated in the 2021 Fiscal Compliance Report. In 2000 and 2010, under the leadership of the former executive directors, the board was waived from a full evaluation. But for more than 20 years, there has been no incident or finding where the board has issued a wrong license or mishandled cash. The findings in the 2021 legislative audit were of a clerical procedural nature, and corrective action was taken by the board to address them as documented in the October 2021 and January 2022 quarterly progress reports. The board respectfully asks that the committee amend this legislation to extend the termination provisions relating to the statutory and regulatory authority of the board, as was originally proposed, to the following. Amendment 1, page 2, line 7, strike 2025 and insert 2033. Thank you so much for your attention.
Okay, and we'll see if we have any questions from members of the committee, but can you just explain that amendment again in plain English? What are you asking that we do? Extend it to 2033?
Yes, instead, we've always been a board that sunsetted 10 years, and it was changed to 2 years. We're just asking for you to extend it again for 10 instead of the 2, because there's no reason why we cannot extend it for 10.
And no deficiencies is great news, right?
No deficiencies, no.
Okay, any more questions from members of the committee? I do not see any hands up, so I will thank you very much for your testimony, and we'll conclude the hearing on Senate Bill 202. Do we have Lorraine Smith available at this point? Lorraine, are you online yet? If not, we will go ahead to the physical therapy examiners. Senate Bill 209, I do see Lori Kendall Ellis here. So Senate Bill 209, State Board of Physical Therapy Examiners Sunset Extension. Go right ahead and present Lori Kendall Ellis.
Thank you, Delegate Kelly. Hopefully you can all hear me. And thank you, Chair and members of the committee. My name is Lori Kendall Ellis, and I am the Executive Director of the State Board of Physical Therapy Examiners. And I really appreciate the opportunity on behalf of the board to share our point of view that the amending of Senate Bill 209 by the Senate from 10 to 2 years is unjustified. I testified in front of the committee. We stated that we also did not have any deficiencies. We were compliant. We were not singled out in the audit, and no questions were asked of me. Yet during the voting session, which was closed, a senator came forward and reduced the 10-year extension to 2. So we did not have a chance to discuss it or to have any rebuttal at that time. And just want to reiterate, we just don't understand. We have no deficiencies. The board has not been singled out in the audit report. We know that both the Senate and the House have the Office of Legislative Audits 2020 report. We received it ourselves in July of 2020. And we know in 2021, the Board of Chiropractic Examiners and Podiatric Medical Examiners were both extended for their full 10-year extension. So again, there's a level of concern, a level of not understanding. We respectfully ask that, as you note in our written testimony, as well as the supporting document that we sent in, that we would, in plain English, as Delegate Kelly said, wish that we would be put to what was originally said and stated in the amendment, that we would be for 10 years and our expiration date would be 2032. Thank you, and happy to answer any questions.
Excellent, thank you. And just, I think I heard this in your testimony, but I want to repeat it. You really have no idea why it was brought down to 2 years. Nobody reached out to you and expressed concerns or a need. Okay. Exactly. Do we have questions from members of the committee? I do not see any hands up, so that will conclude the hearing on Senate Bill 209. Thank you very much. I'm going to call again for Lorraine Smith. If not, we will move on to the MIA bills. Do you think, is she still online? Is Lorraine Smith still online at all?
Yes, and they're unmuted, but we can't hear them.
We're going to move on to the two MIA bills, and then if necessary, I think we can maybe have staff present the sunset extension for the Board of Psychologists if we don't have anyone else who can do it. But let's go to Senate Bill 180, Insurance Conformity with Federal Law, the No Surprises Act, and other provisions of the Consolidated Appropriations Act 2021. I believe we have Dave Cooney and Van Dorsey here. Who would like to present?
Thank you, Madam Chair. I'll do it if that's okay.
By all means.
So for the record, I'm David Cooney, Associate Commissioner for Life and Health of the Maryland Insurance Administration. Senate Bill 180 is a departmental bill that broadly authorizes the MIA to enforce those provisions of the Federal No Surprises Act that apply to insurers and health plans regulated by the MIA. As members of the committee may be aware, the Consolidated Appropriations Act of 2021 was passed by Congress and signed into law by the President in December of 2020. The act included several provisions related to health insurance, including the No Surprises Act, and it is without question the most significant and far-reaching healthcare law to be enacted since the Affordable Care Act. Our written testimony provides additional details regarding the provisions of the act, but in general, the federal law is intended to completely eliminate surprise medical billing in situations where patients either unknowingly receive treatment from a non-network provider or they do not have an option of choosing a network provider. Most of the major provisions of the federal law went into effect on January 1st, 2022. Although carriers are already required to comply with these requirements under federal law, Senate Bill 180 will result in greater clarity and efficiency with respect to enforcement by granting the MIA the same type of authority we currently have for other federal laws such as HIPAA and the ACA. And for these reasons, we urge the committee to give Senate Bill 180 a favorable report.
So did Van Dorsey have anything to add?
I have nothing to add other than unless there are any questions.
Do we have any questions from members of the committee on this bill? We need a second to raise your hands, but I do not see any. So that will conclude the hearing on Senate Bill 180, and we will move on to Senate Bill 185, Maryland Insurance Administration virtual hearings. Is Commissioner Bahrain here? Or are we hearing from Van Dorsey on this as well?
Delegate, I think I'll cover that. Unfortunately, the commissioner is not available at the moment.
No, it's a busy time. Go right ahead.
Indeed. Senate Bill 185 amends Section 2-213 of the insurance article to allow the MIA to hold virtual hearings in appropriate circumstances when, and what this does is it aligns the insurance article with the state government article, the APA provisions that allow for virtual hearings. We found that during the pandemic that this was something really that was necessary and important. The one amendment that was made requires us to have a site where, on site at the MIA, where someone can come in and use one of our own laptops if they need it. It's something that we actually already provide for them. Unless there are any questions, I ask for a favorable report.
Excellent. We have a question from Delegate Cullison.
Thank you, Madam Chair. Van, I was wondering, I want to clarify. So there won't be, when it is a virtual meeting, there won't be any in-person meeting of people, but rather the availability of equipment to join in a virtual meeting if you're not able to do that at your own site.
No, that is correct. That's right.
Okay, just wanted to make sure I was understanding. Thank you.
Yep.
Thank you, Madam Chair.
Absolutely. Seeing no more questions, that concludes the hearing on Senate Bill, 185. And we already did Senate Bill 207. So we're going to return to Senate Bill 195. We are hearing, that is State Board of Examiners of Psychologists Sunset Extension. We are hearing technical difficulties are making it impossible for Lorraine Smith to join us, but she has sent this message. I will make sure the committee hears. Her testimony is identical to that of the Board of Physical Therapy Examiners. So she has the same perspective on their sunset extension as the Board of Physical Therapy Examiners did, which I would assume means they would also like to have 10 years instead of 2. So with that, do we have any questions that I will do my best to field? No, good choice, committee members. Senate Bill, that concludes the hearing on Senate Bill 195. And all of our hearings for the day. Go team. And we will be on the House floor at 2:30. Anything else to add, Chairman Pendergrass, before we conclude?
Only that you did a great job as usual.
Thank you very much. With that,